The Trump administration is poised to make a significant announcement today, suggesting a potential link between the use of acetaminophen, commonly known as Tylenol, and an increased risk of autism when taken during pregnancy. This claim comes despite the absence of definitive scientific evidence establishing a direct causal relationship between the two. During a press conference scheduled for this afternoon, U.S. Secretary of Health and Human Services Robert F. Kennedy Jr. is expected to present these findings. President Trump hinted at the importance of this announcement, stating, "We're going to have one of the biggest medical announcements in the history of our country. I believe we have found an answer to autism." This declaration marks yet another instance of the administration challenging established scientific consensus on widely used medications, including vaccines and abortion drugs. Critics argue that this approach is part of a broader strategy to undermine the scientific community and promote a political agenda. Robert F. Kennedy Jr. has long focused on autism, vowing shortly after taking office to identify its causes by September. He has pointed to various factors, including synthetic food dyes, childhood vaccinations, and painkiller usage as possible contributors to the disorder. Interestingly, while autism diagnoses have surged threefold over the last 20 years, the use of acetaminophen has remained relatively stable during that same period. Furthermore, experts widely acknowledge that genetics play a crucial role in determining a child's likelihood of developing autism. The disorder tends to run in families, and if one identical twin is diagnosed with autism, the other is likely to be as well. Some smaller studies have hinted at a possible connection between fetal exposure to acetaminophen and later diagnoses of autism spectrum disorder, ASD, and attention deficit hyperactivity disorder, ADHD. However, the most comprehensive study to date, funded by the National Institutes of Health and conducted by a collaboration of U.S. and Swedish researchers, found no increased risk associated with acetaminophen use. Prior to the release of this study in 2024, a U.S. district court had already reached a similar conclusion in a product liability case, further questioning the claims being made about acetaminophen. In contrast, organizations such as the Society for Maternal Fetal Medicine continue to endorse the use of acetaminophen for managing fever and pain in pregnant women. They argue that failing to treat fever can lead to severe complications, including miscarriage, birth defects, or premature birth, particularly in the early stages of pregnancy. Additionally, the administration is expected to propose that leucovorin, a form of vitamin B often used to address deficiencies caused by chemotherapy, might be beneficial in preventing or treating autism. This suggestion is based on research indicating that many individuals with autism may have a metabolic issue that limits the amount of folate reaching the brain. Leucovorin could potentially bypass this metabolic barrier. However, while leucovorin interacts with systems critical for brain and nervous system development and is sometimes prescribed off-label for autism, the evidence supporting its effectiveness remains limited. The Autism Science Foundation recently stated that there are 4 studies indicating low folate levels in pregnant women might elevate the risk of autism. Nevertheless, they emphasized that this area of research is still in its infancy, and further studies are essential before any conclusive statements can be made. But here's where it gets controversial. Are we truly ready to accept these claims without more robust evidence? What do you think about the administration's approach to linking medications with autism? Join the conversation in the comments below.